Good evening, everyone. My name is Brenda Ahlberg, Kenai Peninsula Borough Public Information Officer, and tonight with me is Dan Nelson, our Incident Commander for the Borough's Incident Management Team. We wanted to provide you a brief update tonight. We apologize ahead of time for not giving you a notification as we're working through some technical issues trying to bring this to you on a nightly basis. Our effort here is to try to get you something every night, and in going forward, we'll do so around 7 o'clock, the dinner time hour, I know, and or after dinner, I should say. And I'm going to pitch it over to Mr. Dan Nelson, our incident commander, for today's update, please.
Thanks very much, Brenda, and good evening, everyone. So thanks so much for joining us. Today it was a busy day of some coordination and some developments as we took some action here on the Kenai Peninsula and continue to coordinate with all of the agencies, the state, cities, local, healthcare industry throughout the day. The biggest thing that I want to share with our group is folks that are using borough services. We've said repeatedly that our continuity of operations plan ensures that our services remain in effect. They certainly do. But today we have taken the step to begin to close the Borough Administration building here in Soldotna. That's the final building that had limited public access, but for safety, we're closing that to the public beginning tomorrow and encouraging everybody to do their business with us in other ways. And we've got some great ways that we'll announce and talk about to help with that. From there, working with the Department of Health and Social Services with the state of Alaska, as well as our hospitals and other agencies to do a coordinated response. And our incident management team has been working hard to get those things coordinated and work through issues to ensure that services still remain and that accurate information is getting out to the public. So that's just a real brief summary of what happened today at a high level.
Thank you, Dan. We're gonna wait for comments to come through Facebook. I know that, like I said, we weren't able to promote this ahead of time, but certainly we'll stay online for a few more minutes to see if folks have questions. In the meantime, wanted to ask you about testing down here on the peninsula. Folks are wondering if we are going to have drive-up testing. Is there ability to test? How easy is it to get a test? Can you give us some sort of a comment on that?
Of course. So the big question on everybody's mind is that testing. And right now we're again working with the state through our healthcare facilities to take care of testing. So we don't have drive-through testing at this point. And that's something that it may be looked at, but at this point in time in the borough, we do not have that. And you may have seen that in Anchorage and that dense area. So for right now, for testing, what you need to do is get a referral, get a prescription from your healthcare provider. So just like we've been saying, if you end up where you're having symptoms, you're feeling ill, you have some of the symptoms of COVID or another respiratory illness like a cough or cold, then go ahead and call your healthcare provider. Again, don't go into the office. Give them a call so they can go through and talk to you about your symptoms on the phone. And if they need you to come in, they'll give you instructions they can prepare. If they do recommend testing based on the criteria that the state has put out, they'll give you a referral and give you instructions. And right now, those tests are sent off. So there's a little bit of a delay in getting the results back, but you have to start with your healthcare provider to do that, even in Anchorage where there is drive-through testing.
Thank you for that. And I want to remind folks that the self-assessment tool that's available through providence.org is a good tool. I actually looked at that. It walks you through very clearly some expectations and then prompts you to the next level if necessary. I would encourage folks to go there if they're curious or if they believe they need to get some additional information before they call their healthcare provider. I think that would also be helpful. And then for general comments or questions, they can certainly call the 211 number. That's statewide available to folks, as well as an 800 number. I've heard folks are not able to get into 211 depending on where they live, so they can certainly call 800-478-2221 if they would like some additional information. And just a shout out to those volunteers and medical providers that are on that 211 system managing those phone calls. They're doing a tremendous job. Another question that came up was, how is the state going to continue to make announcements, particularly here on the peninsula, if and when we do have some cases here on the peninsula. Can you talk a little bit about that?
Of course, and we coordinate those announcements through the local healthcare providers, the hospitals, through the state. So the state of Alaska will be announcing if we do have cases, kind of by community as they come up. We're not putting out a whole lot of specific information for privacy's sake and for the patients that are dealing with those things, but you'll hear about it more on a general level. And of course, KPB alerts. Our page at kpboem.com is repeating that legitimate information that's coming from Health and Social Services and our local hospitals. So you can expect to see that type of announcement, but it's really something that we don't want to get into a lot of detail about patient privacy and other things. So it will be general, and please expect that and respect that for the patients and the family that are going through these types of things.
Thank you for that. That leads me to, something that has been circulated today in the information shop is the rumors that are really starting to take off on social media about potential cases or exposures, and want to just remind folks that from a personal perspective, being able to support our neighbors and our loved ones in the event that they are exposed or there potentially is going to be a confirmed case in the future. We don't want to create stigmatisms, and as the ability to provide that support. That's something I think all of us as Alaskans are really good at doing in times of crisis. I just want to remind folks that it's imperative that we remember that during this time.
I think our communities here on the Kenai Peninsula come together better than anyone else. And we've seen that in our emergencies from many, many times over. And thank you to everyone in the community that is doing that now and has done that. And, it's a time of high anxiety. And that's something for us all to remember. There's a lot of worry. There's a lot of differing information, rumors, and those things that are really circulating. And we have these great tools like Facebook Lives and social media and internet and all of those things that help us communicate better. But sometimes that's a double-edged sword. So I think that just what you said is as community members, as neighbors, let's watch on repeating those things that we might have just heard or read that aren't really coming from an official source, because sometimes that does more harm than good, and we don't know what our neighbors are going through. We don't know if those are rumors, if they're fact, and I think it's just better for us as a community to come together rather than kind of have some of that negativity.
Yeah, one thing that I've also noticed is, with addition to rumors and hyped conversations on Facebook, or even conversations among folks here in general, we got to think about those. My mom called them little flowers, the ears of children, and what their perception might be here, and as well as elders that need additional care or guidance and are living in homes or living in assisted care that are not able to see family members right now, and they equally are concerned. So and then I also think about those folks that now have to self-isolate, that thrive on being in community and around people. That's difficult. So just want to throw that support out to folks as well.
You're absolutely right. And I've also seen a lot of offers when we're talking about elderly and some of those folks to go and get groceries and to help with some of these things. And what a great thing. And that's why I say our communities are better at that, I think, than anybody else's. I'll stand by that. So that's a great thing to do. And definitely think about your social distancing and think about all of those things. But, it also doesn't take much effort, those folks that we can't visit to write a letter or, send pictures or do something to folks that may be in those assisted living facilities, or parents and grandparents, and that extended social network that we have to pick up the phone and give a call and have a warm and calming voice. And these times truly are unprecedented. So being good neighbors and friends and family, I think, is key to helping us all get through it.
Thank you for that. Just some closing comments. We wanted to try to bring this background to being brief. I want to remind folks of our blog, kpboem.com, and why that has the importance to the community. What is that about? Why is that so important to the Kenai Peninsula and to our folks that live outside?
And it's sort of the same things we've been talking about, is that legitimate information, the information that's coming from the response agencies, from healthcare, all in one place. So that's especially good for all of us here that live here, our residents, people that are thinking about visiting, or people that have family here on the Kenai Peninsula. So that's a place you're not going to see rumors. You're going to see verified, factual information, which is just so critical in these times right now. So I encourage people to share that website, that link, kpboem.com, at the Office of Emergency Management, and make sure that when you're getting your specific information, when you're looking for an answer, chances are that local information is there on one of the posts, but there's also great links to also some additional agencies like the state where that legitimate information is happening. Phone numbers, that 211 phone number, if you need that 800 number that we mentioned earlier, that's where it is. And you will see updates from the borough and from the cities and from all those agencies going right to that place. So a one-stop shop is what we're trying to make it.
Thank you. And for those that also like Facebook, we got KPB Alerts, right? KPB
Absolutely.
Alerts on Facebook, and we're also trying to resurrect a Twitter page. So please be patient with us as we get that spooled up as well for you. In closing, we're going to catch up with comments that are online. If we weren't able to answer your questions tonight, we'll certainly catch up after this broadcast, and wanted to thank you, sir, for taking the time out of your very, very busy day to talk to our public. Any closing words for us, sir?
No, just thank you everybody for joining us today. And like we said earlier, keep positive, keep those social networks. We like to say we keep talking about social distancing, but we're physically distancing. So think about friends and family you haven't seen, pick up the phone, pick up FaceTime, take advantage of some of these new technologies we're learning how to use tonight. We're gonna try our best to be here consistently at 7 o'clock each night on Facebook Live. Track our Facebook and website, our Twitter account. We'll get that set up again and kind of solve those issues to get information to you if you use that platform. So I want to thank, on behalf of Mayor Pierce, the Borough Administration, all of our residents, all of the people that are working tirelessly as first responders, as medical personnel through this time of very high stress, and of course, all of us that are living through it. So thanks for joining us this evening, and have a great night.